Hey, thanks for joining us for a chat. Just under 5 million people in Australia have experienced anxiety, an anxiety disorder. So that's why we're talking about, with Colette, managing anxiety. So important, and it's so prevalent, I guess, in this day and age.
Absolutely, and we've actually just seen the joint release of a statement by the Black Dog Institute and Mission Australia. So they do surveys of young people around Australia every year, and their recent one of 27,000 young people between 15 and 19, they found that 1 in 4 young people meet the criteria for psychological distress, and that this is a marked increase over the last 7 years. So our young people are struggling more.
1 in 4 between the ages of 15 to 19 are suffering with some sort of a mental disorder. That's so
and so the concern is the increase. What they do say is they're not completely sure why. A lot of experts are still kind of at a loss. We know certain things. We know we need to be careful we don't just blame social media. It does exacerbate the issue for teens who are already struggling with mental health, but there's many areas and many reasons. But I think really it's important for us to look at the signs and symptoms in our young people.
What are those signs?
So it will vary depending on our children, depending on where they're at and what's going on in their lives. But my favourite definition is by Gordon Newfield from the Newfield Institute in Canada. He says we need to look at anxiety the same way we think about an alarm system, a smoke alarm. So anxiety is a faulty alarm system. So for some children, they are registering in their brains that the toast is burning, when in actual fact, their brain thinks that the whole house is burning down. And it's actually just something as small as toast in their minds in terms of anxiety. And so it's helping young people to manage their anxiety, their levels of anxiety. Sometimes their brains trick them to think that they're in danger. Now, our brains are amazing. Anxiety isn't always bad. Anxiety keeps us safe. It stops us from standing too close over the yellow line at the train station.
Having some sort of a self-awareness?
Absolutely. It stops us being hurt. And it's an amazing thing given to us in our brains. But when that alarm system is faulty, our young people can develop symptoms in their bodies, sweating, headaches, physical stomach aches. Little children will say, I've got a sore tummy or I feel sick. Children will begin avoiding things. And one of my lines
they raise alarms. Right? When you know your child usually likes to go to school, usually likes to go to soccer practice, then all of a sudden they don't want to go. You need to look further and talk further with your child what's going on.
We'll see changes in eating patterns for some children, changes in sleep for some children. There's many things that we can look at with our children, but I think some of our children become very rigid or pessimistic. Some children are absolutely perfectionistic because they're so anxious about making mistakes. And for some children, their anxiety comes out as anger. Okay,
so what can we do, Colette? What can we do to help our kids manage this anxiety?
So I think there's many things, but things like teaching deep breathing, teaching them relaxation techniques, teaching them what I call the stepladder approach. So breaking tasks down into small chunks that your child can just manage or get victories over little things in their lives. And if your child is really struggling, I think it's important to seek professional help.
So true. We'll finish on that note. Seek professional help if you need the help, and talk to a trusted friend or family member about what you're going through.